Okay, here we are with Susan, and we've done several different testimonies with Susan in our office because she's had a lot of wins. And I wanted to do another testimony because there's some real life-changing things that has happened to her care in the last 3 or 4 months. And the wins that you had initially is that we helped you get over restless leg syndrome. We helped you overcome a frozen shoulder that had been frozen for how long had it been frozen?
A year and a half.
A year and a half. So you couldn't move your shoulder at all, and we helped you with that.
Yeah.
And we helped you with some neck and back pain. And you also had an issue with a hip. So tell us about what was going on with your left hip.
About a year and a half ago, well, just prior to coming here, I went to my regular doctor and I found out that I had osteonecrosis, which is actually like a square peg in a round hole.
Right, and you weren't getting, the doctor explained that you were lost blood supply to your hip. So your hip was basically not getting any tissue, blood to the tissue, and it was basically kind of like falling apart.
Yeah, it was degenerating.
Decaying, it was decaying.
Yes, it was decaying fast.
Right, and even despite that, we were able to get you off, because when you first came in, you had a cane.
Yes.
And with the care that we had provided, you were able to get off the cane, but because you're getting blood supply, we knew that would not be able to get over that.
Right.
So you got a lot better, and then you decided to go to your doctor, your surgeon, to see if he would operate on the hip. And based on what did he tell you, and why did he tell you? What he told you?
A couple of months after I was coming here, I went to my orthopedic surgeon and asked him if he would do hip surgery. And he said no.
Okay.
And I broke into tears and said, why?
Right.
He said, with your health the way it is, he says, I do not want to kill you.
Right, that you might die on the table if you...
Yes.
All right.
Or if I didn't on the table, it would be from an after surgery, from pneumonia,
something like that,
blood clots from poor circulation, or I just wouldn't heal because of another disease that I have that keeps me from healing.
Right, the poor lymph circulation.
Yes.
Right.
Yes.
So when we got that information, we got real busy and we started working on your metabolic side of your health.
Yes,
we changed your diet. We found that you had foods that you were eating that were causing inflammation. We found that there were some hidden infections going on in your body that your body wasn't tolerating. And as a result of finding those things and cleaning that up, you lost like a ton of weight. How much weight did you lose?
I lost 40 pounds in 18 months.
40 pounds in 18 months.
Just from changing my diet.
Wow, that was amazing. And what also did you notice? What other things improved other than just the weight loss?
I had more energy. I had my cuts and bruises started healing much faster than they ever did before.
Okay.
Which gave me a good feeling that if I had surgery, I might heal faster than I would normally have healed.
Right, exactly. And did you notice also more energy level?
Yes.
Digestion also got better too, right?
Yes, much. You put me on HCl for my acid reflux. I no longer have to take that because my stomach's doing
great.
Fine.
Awesome.
Yes.
That's very good. Good.
And my homocysteine level has maintained.
Right.
And my glutathione level is maintained. And these are all things that you found that my normal doctor
did not find. Right. Yeah, we're very, very comprehensive with what we do here. And so with all these improvements, you went back to the doctor a couple months ago, and what did the doctor say when he laid eyes on you?
I asked him if he would do surgery, and he looked at me and he said, remind me why we wouldn't do surgery. And he looked at me and he said, yes, I'll do surgery on you. Your health is so much better now for everything you've done. He said, I could tell when I walked in the door, I looked at you, and the color of your skin was so totally different than it was a year ago.
Right.
He says, I have no problem doing surgery for you.
Good. And you ended up having the surgery, and how successful was it?
I had surgeries, it'll be 7 weeks, and I am walking, no cane, and I'm doing well. We're just working on my muscles now.
That's awesome. Now, curious, if you would not have ever come to our office, what do you think what kind of future would you have had if you hadn't been referred to our office?
I would have been in a wheelchair a year ago.
Right.
If I hadn't met you, you're the one who kept me walking.
That's right. That's awesome. That's a beautiful story, and it's really important that we share that with people. if you knew people who were having chronic health issues that weren't seeing results, would you refer them to our office?
Oh yeah, without a doubt.
Awesome. Appreciate
Without a
that so
doubt.
much. Thank you so much.